Good afternoon. Welcome to St. Clair County EMA for our daily briefing. Sorry we're running a few minutes behind, but it's been a little busy day today. We're joined here with Sam Bierman from the Health Department. Sam, more numbers today.
We do have more numbers, and as on the trend, they are continuing to rise. So, as we have done in the past, the numbers that we are going to report to you first are St. Clair County residents that have been tested, and we are at 1,266 that have been tested. We are at 300 that are positive, which is an increase of 13 from yesterday, and that includes both males and females from teens through the 80s. We are at 899 negative test results with 67 test results that are still pending. And I do have some sad news to report today that we are reporting one additional death, so that takes us up to 19, and that patient was a female in her 90s who did have underlying health conditions. For state totals, we're at 148,358 that have been tested, 31,508 that are positive test results, which is an increase of 1,151 since yesterday, and we're at 1,349 deaths today, which is an increase of 59. And as always, our condolences go out to the family members who have lost loved ones to this virus. As we did a few days ago, the hospitalization numbers that we are now bringing to you, we have 72 patients that are hospitalized in St. Clair County hospitals due to COVID-related reasons, and 5 of those patients are on ventilators. For long-term care centers and outbreak status, and just to clarify, outbreak status does mean 2 or more, and that can be a combination of staff and or residents at a facility that are COVID positive or that do have symptoms that indicate COVID positive. Brea of Belleville has 12 cases and 1 death. Colonnade in O'Fallon has 2 positive cases with 0 deaths. Four Fountains in Belleville has 12 positive cases and 1 death. And Memorial Care Center has 13 positive cases and 1 death. And before I turn it over to you, Chairman Kern, there are a few things that I would like to touch on. The first is I'm going to go over with you a new graphic that the Illinois Department of Health put out today, and that is regarding the homemade face masks, that the do's and don'ts of wearing those face masks. So obviously we have a few in the do column, and that would be to make sure that the fabric that you're using is breathable, that you have no problems breathing when you're wearing it. Wear it whenever you're going out into public, making sure that the mask does cover your nose and your mouth completely, and to make sure that you make it out of a fabric that can be easily washed. The don'ts would be to not use on children under the ages of 2, and to not use surgical masks or other protective PPE, which possibly would be an N95, that is intended for healthcare workers and or first responders. And when we talk about wearing a cloth face mask, we want it to fit snugly, but not be too tight. We would like for it to be secured by loops or a tie around the back of your head. It could possibly include multiple layers of fabric, and as we said earlier, allow for easy breathing without any restrictions and able to be laundered. If any of you are still looking for information on how to make a homemade mask, we will put the link for that in the comments, and that will take you to CDC, and they have some great instructions on how to make masks out of the cloth material. And before I turn it over to Chairman Kern, a few of the things that we just spoke about, and I'm sure anybody that is on Facebook has seen, they have headbands now for healthcare workers that have the buttons sewn on so it protects your ears. One of the things that we have put, and just so you guys know, this is a mask that is not usable. It had liquid spilled on it, so I am not wasting a mask that could be out in the hands of the first responders. When we talk about making sure that it covers your nose and mouth, I'm going to turn him sideways so you can see. We want you to pull at the top and bottom so it goes all the way over the bridge of your nose. You want to pinch across the nose and then make sure that the bottom of the mask comes down below the chin. And as we had said, the ear savers that they have talked about, if you don't have one of the fancy headbands that has the buttons on it, Most people would have access to this in their home. This is simply a paper clip. And there you go. If you are going to be out in the public a lot and you want to wear the mask and save your ears, you can use a paper clip. You can also use a binder clip. And when you go to do the binder clip, simply you're going to open the binder clip like this. You're going to put the strings inside, and then the flat edge of the binder clip is going to sit against the back of your head. And then that will keep that in place without rubbing your ears raw. The final thing I would like to talk about before we hand it over to Chairman Kern is proper PPE disposal. I cannot say this enough. We see gloves all over the place. If you are going to be wearing gloves in public, please make sure that you are disposing of them properly. If it's when you get to your car and you don't want to wear them while you're in your car, put a little, Walmart grocery sack, have it in the door handle of your car so you can put the gloves in there, and then you can dispose of them when you get home. Please don't throw them outside of your car as you're leaving the store or you're leaving the gas station. Kind of defeats the purpose of, wearing the PPE to protect others and yourself if somebody else has to pick up that stuff off the ground. So now I will turn it over to Chairman Kern.
Thank you, Sam. That's great words of advice. We appreciate the mannequin demonstration.
Absolutely.
It makes it easier. We have all heard new terms during this pandemic: PPE, social distancing. The next term of art that you're going to hear is called contact tracing. Yesterday, our state representatives and state senators from Illinois announced new testing sites that are going to be ramping up. Along with the ramping up of new testing and the results that we will find that people are COVID positive in St. Clair County, will come contact tracing. That is where we are going to be at the health departments in touch with anyone that a COVID positive person has come in contact with. They will then be contacted to let them know that they might have been in contact with a COVID positive person. So what we would suggest here is that maybe you start keeping a diary, date that diary and say, on Monday, these are the people I saw today. That will help you in the future in case you are found to be COVID positive, that you would then be able to go back. It's always kind of hard to remember things, and so this would allow for you to be able to have a quick answer. Yes, on Monday, Tuesday, whenever that would be, here are the people I was in contact with, and it would make contact tracing something that would be easier to perform. So just remember contact tracing, and we'll be looking at that in the future. I've got zip code reports today. 62201, we are at 8. 62203, we are at 10. 62204, we are at 9. 62205, we are at 9. 62206, we are at 22. 62207, we are at 15. 62208, we are at 19. All of those remain the same from yesterday. 62220, there are now 21. That's an increase of 3. 62221 remains at 28. 62223 remains at 20. 62226, there are 43 now. That is an increase of 1. 62258, there are 11. And 62269, there are 24. That is an increase of 1. We also noted from this, and you'll remember if you've watched before, we don't report any zip codes. We're not allowed to where there are less than 5 COVID positive cases. But we did note that a number of the cases today that are positive, that Sam announced earlier, are happening in those zip codes that we haven't been able to announce yet. So we need to just all band together, keep doing what we're doing, social distance. We still are not at that peak. That will be coming hopefully in the next week or 10 days, and at that point then we can start discussing how things are maybe going to open up in the area. And in order for things to open up and the economy to get back moving, it's important for programs like those that are being offered at the St. Clair County Intergovernmental Grants Department to be put to use and to be put to work. And so today, Rick Stubblefield is here from the Grants Department to talk about a couple programs and opportunities for the public, the St. Clair County public, to be able to access. Rick, welcome.
Thank you, Chairman.
So why don't you just lead
Dive
off?
in?
Yep, dive
All
in.
right. So as you'll recall, a couple of weeks ago, when I was here, we talked about putting an application online. We wanted everybody to have access to an application. And maybe I'll back up just a little bit. For anybody that doesn't know, the Grants Department is an umbrella department of county government, and we administer many federal and state grants. A lot of these grants are social service related and give us the opportunity to help in just this kind of a crisis. So we have gotten our application online. If you go to the St. Clair County website, www.county.st-clair.il.us, you will find it on the homepage. It is listed in the box marked Information and Resources on the front page, and it is under Grants Department Accepting Relief Applications.
And that's on the St. Clair County, Illinois homepage.
Correct. The application, this is what you'll see when you pull that up. I will let you know that this is a fillable application. You can fill it out on a desktop or a laptop computer. Doesn't work on a phone, doesn't work on a tablet, but you can do it on your laptop or your desktop computer. If you don't have access to that, we are more than happy to mail you an application. You can call our office, 618-825-3200. We will put an application in the mail for you the same day that you call. We will include a self-addressed stamped envelope so that you can return that information to us. And if you need help filling it out, give us a call. We'll walk you through the process as you do. There's going to be some things that you're going to need because everything that we do is eligibility based. But I will tell you that during this time, the eligibility has been relaxed and the services have been expanded. So where we are normally at 125% of federal poverty level, that has been expanded to 200% in the case of Community Services Block Grant. Some of the things that we're assisting with now are rental assistance, mortgage assistance, automobile payments, car insurance, water. We have electric, which we normally do through our low-income home energy assistance program, LIHEAP. LIHEAP has also been expanded, and the same application will work for both. So you can get CSBG service and LIHEAP service without having to file two separate applications. We'll work with you, we'll transfer your paperwork, the paperwork that you filled out, from one to the other to make sure that everybody gets everything that they have. We're dealing with a great many people now that have never needed these services before, and we want to make sure that we can help as many people as possible. I will say we have mailed out over 400 applications in the last 2 weeks. They're all beginning to come back now. So I would ask, please be patient as we go through them. We will be bringing on more staff to help us get through it, but it'll be a little bit of a learning curve for the new people. In addition to those services, to the CSBG and the LIHEAP, workforce development continues to move forward. Workforce has jobs open. They're still working with employers who are looking for employees. They can help with on-the-job training. There are people that are thinking this is a great time to maybe switch careers. And so we're working with that. The apprenticeship programs are still up and running. We continue to work with the community colleges and the universities to work on programs that will allow for remote training and things like that.
So let's just expand on, so we talked about 3 programs that are available to the public that a lot of people are out of work, a lot of people have issues right now, a loss of income in the household. So CSBG You talked about rent assistance and car insurance. Is it a pretty broad range? And these are federal requirements that you are making sure that the public meets when they call. So the income levels, what is that income level again? And is there a dollar amount that you can talk about there?
Well, it's 200% for CSBG. It has expanded from 125% of the federal poverty level to 200%, but that is based on total household income. So from a dollar level, it's a little bit hard to expand because it will depend on how many people were in your house working, how many people live in the household, and things like that. So obviously, it's a much higher number for individuals that have 5 people versus an individual that has 1.
A lot of those programs went back and said, a lot of people are rightly so saying, well, I had a job last year and I just lost my job. So when you base things on income, it would be last year's income, and that really isn't fair because I have no income now.
And that's true, and we don't base it on that. But historically, the way that CSBG has worked is it has been 90 days of income. So we have looked at your past 90 days and said, you meet this level. That's changed during this pandemic, and we're doing what they call preemptive income, or presumptive income, I'm sorry. We're looking at 30 days of income, your most recent 30 days, and if you have been laid off, if you are out of work because of this, and we'll look for a note from your employer, we'll look for unemployment, we'll look for things like that, we're going to presume that that job is not going to come back in the next 60 days. So now we're not looking back where you might not have been eligible because, your last 90 days was going to be over that threshold. Now we're saying we're going to look forward during this time because we know you're not going to have any money coming in.
So it's fair to say you're looking for ways to help people. You're looking to try to make sure that the rules admit as many people to this program as you can. There are significant dollars that are there, so we encourage people to apply that are definitely in need and need this to get by. We're asking for you to send in those applications.
And you're absolutely right. We are looking for ways, and we obviously have your support on that, and we have the state's support on that, to look for ways to expand this program as much as we can. We're receiving CARES Act dollars to these programs, to CSBG so far. I would expect that we will be getting some for LIHEAP in the near future. I would expect that Workforce will get some as well.
And those are federal dollars that are coming through the federal stimulus bill.
Those are the CARES Act or federal dollars. We have some state dollars that are coming into us as well. So I would encourage you, even if you don't think that you're eligible, if you have a need, I'd encourage you to reach out to us. Let us tell you no versus you just assuming that there's no way for us to help.
Because the reality is most people that are in those type of circumstances being laid off will qualify.
Correct.
So LIHEAP, LIHEAP, it's basically a utility assistance program. So if you have an electric bill or a gas bill, your LIHEAP program will help people be able to pay off those bills so that they don't have to worry about that particular bill in the household. LIHEAP program is well funded?
It's very well funded, and what we're hoping, right now there's a moratorium on shutoffs. Well, they're going to lift that, and I think right now the date was supposed to be maybe May 1st. I wouldn't swear to that, and it may get expanded, but we don't want everybody to be sitting on a disconnection notice as soon as that comes up with 3 months of bills. Work with us now. Let us get ahead of it so that you're good to go when they lift that moratorium and you're not sitting on a huge power bill that you can't move forward with.
So I know that St. Clair County has one of the best, the most well thought of workforce investment programs in the state. So if someone has lost a position, they can access through your office job training, certain dollars that may go along with the unemployment to be able to help people get back on their feet with a job. And you even have a certain amount of employers that are looking to hire at a certain skill level.
Which is true. We still have employers that are looking to hire. I think I put one out on social media last week. But there are a lot of manufacturers that are still looking. The healthcare field is looking, it may not be a bad idea to entertain at this time going from that job that's hourly wage and was a beginning job, a start job, to maybe looking at transitioning to what might be your career.
Because just because a person doesn't have the skills for the particular job, the new job that's open, you pay for training.
We do pay for training. We have federal dollars available for that through the Workforce Innovation and Opportunity Act, and those dollars are used just for that, for training. We work with employers. Anymore, a lot of employers want to train their own, grow your own, if you will. So that's where our apprenticeships dollars go. That's where our on-the-job training dollars go. We will work with employers who say, I like this individual. This individual is a good fit for my team. And we'll say, you know what, we'll pay a percentage of this individual's hourly wage for a negotiated amount of time while you bring them on board and get them trained.
So I know this is National Laboratory Week and lab techs. You can train lab techs. We're so appreciative, and look how valuable that position has come to be always, but especially during this pandemic. Those are jobs you have access to healthcare training that you can provide in your program.
We absolutely do. We can train any medical related field. We do an awful lot of medical assistant training, lab tech trainings, nursing. So we have funds available for that. Again, it's all eligibility based, but now is a good time because everybody's eligibility is low.
So all our governmental entities, our state and our federal entities, the Governor Pritzker and the President of the United States and the Congress and our state Senate and state representatives, everybody is realizing that if we're going to get this economy back running, first thing we have to do is to get our people back working. And so you have the programs to be able to do that, to help people transition if they have a bill that's worrying them, that's due and payable, that's going to impact their lives. Those are things where they can go to your website through the St. Clair County homepage. They can access intergovernmental grants. And Rick Stubblefield, you'll be able to be there to help people.
We will do everything that we possibly can to make sure that we help everybody that's eligible through our programs.
Great. Herb Simmons?
Thanks, Rick. It's always great to have you come in and give the insight on what we can look forward to help people that's going to need it as we work our way through this pandemic. So I really appreciate you coming in. Thank you.
Thanks, Rick.
You're welcome. Good. And on the EMA side, we received some more PPE today from IEMA. We really appreciate all the help, as I keep saying, our state legislators give us, and Chairman Kern working the phones to make sure those supplies keep coming in for our first responders and our hospitals. We're working on requiring some resources to accommodate the opening of those 2 additional testing sites that Chairman Kern talked about. We'll have some more information on them shortly. Our conference call with the hospitals and EMS this morning went good. And then we had the conference call with the state legislators this morning and Chairman Kern. And before I go, you heard Sam. She comes in here every day and she gets to report the gloom of those numbers. They continue to rise, another death. And unfortunately, we're looking forward to that day we can come in here and there are no numbers to report. But as Chairman Kern said the other day, and I've heard him say a couple of times, it's like your foot on the gas. We can't let up on it now. The deaths go up and every day. And this isn't for those who are following us daily, and there's a lot of yous out there. I know you understand. For the ones that are still the doubt that this is real, I'm telling you, this virus is here. It's in every part of the county. We see those numbers. So I want you to think about this. I want you to think whatever it's going to take. Evidently, the numbers increasing hasn't convinced you that yet. And they're going to continue to increase for a while. But just stop and think. It's a lot easier to stay home for a little while longer, like Chairman Kern said. Let's get through this, and then we'll start doing the tracing of it, the tracking. It's a lot easier to stay home for a little while longer, keep the door closed, rather than have a casket closed on a loved one forever. So stay home, stay alive. We'll be back in just a few moments with our Spanish version to our Spanish community, and then we'll be back here tomorrow afternoon at 3:30 for the daily briefing. Thank you.